In this video, I will try to explain several strategies that can be used to help manage some of the major symptoms of COVID-19. Now, first off, I'd just like to review typical early presentation of disease as well as some of the basic symptoms so we know what symptoms we are going to be treating. So, in other words, what does a patient with COVID-19 look like? So generally, patients develop cough and fever. They develop these symptoms somewhere between 2 and 14 days after exposure to the virus. Some will have sore throat, some have gradually worsening chest congestion, some feel achy, some feel tired. Up to 80% of patients just describe a generalized malaise. In addition, many individuals complain of just general body aches, headaches, nausea, diarrhea, dehydration. In the most severe cases is when patients start to complain of things such as shortness of breath, chest pain, even confusion, and some become disoriented. Now, most patients, again, are sick for about 5 to 7 days. A certain subset do tend to worsen, maybe up to 10%, may begin to experience worsening symptoms after that 7-day time period. And I like to just go over that one more time because when someone does develop worsening shortness of breath, chest pain or pressure, bluish discoloration around the lips or face after that 7-day time frame, that would certainly be a point at which we would like those patients to be evaluated in the hospital setting and to no longer manage those symptoms at home. Before I discuss over-the-counter medicines, it's important to mention that individuals who do become sick with COVID-19, that they should continue to take their usual medicines. This might include medications for high blood pressure, for diabetes, for heart disease, many other disorders. By keeping these conditions under control, it certainly helps individuals to recover from a COVID-19 infection. It is important to be in close communication with your healthcare provider during the course of illness such that they can oversee any necessary changes in your medication regimen that might become necessary. Now, there are a lot of widely available over-the-counter medicines which can help with cough. Over-the-counter cough and cold medicines certainly might help with cough and congestion symptoms. They might include cough suppressants, cough drops, soups, even teas or hot beverages in general. Some individuals even promote beverages with a little bit of honey, perhaps gargling some salt water for some aspects of cough or sore throat. Sometimes encouraging the patient just to have a hot shower, to breathe steam from a shower, may help relieve some of the congestion, help to open up their lungs and allow them to breathe a bit easier. Now, humidifiers can be used, but caregivers should be aware that this might increase the risk of spreading the disease simply by allowing the formation of air particles. So that may be something that a patient could do, but would not be advised when the caregiver is in the room. Symptoms such as nausea and diarrhea certainly can occur. There are some over-the-counter medicines for nausea and diarrhea that can help relieve some of these symptoms. There are also prescription medications that may be available from your caregiver for these disorders. Caregivers should really be aware of possible dehydration. In order to combat this, it's important to make sure they have adequate water or other electrolyte-containing beverages. Pedialyte is certainly something that may be used. If a patient cannot hold down any fluids, it's important that they try to just sip small amounts of water or Pedialyte every 5 to 10 minutes. In this way, even if someone is actively having nausea or vomiting, they frequently are able to keep themselves adequately hydrated. Now, if they were to develop serious signs of dehydration, this might include confusion, altered mental status. It might include inability to urinate, reduce urination. If any of that were to happen, it would certainly be advisable to seek out additional care.